Today we are going to talk about osteoporosis, how to prevent it, and how to delay its onset. We are going to talk about predictive genetics, genetics of osteoporosis, and finally about how to perform a genetic study of this disease. Predictive genetics is the medicine branch allowing determination of the probability to develop certain diseases and providing adequate preventive measures with the objective to avoid the disease. When disease cannot be avoided, at least delay its onset or diminish the symptoms. Every method to predict future diseases is based on genetics, genomics, and DNA studies. The more we know the information contained in our genetic background, the better we can adapt the environment and prevent the disease. So this know, change, prevent is the basis of predictive medicine. There are genetic diseases in which a single mutation in a single gene is responsible for a single disease. These are rare diseases, monogenic diseases. We can see them on the left. But the most common diseases are on the right, and with the genetic component is polygenic. There are many genes involved, and each of them has a different change or mutation, and it is the addition of the effect of these various genes that is going to cause the disease. These diseases are multifactorial, and environment also affects the pathology. The most frequent within the general population are presented here on the right. We can find among them cardiovascular diseases, cancer, diabetes, obesity, celiac disease, osteoporosis. It is like playing Russian roulette. We have the black numbers, which are the genetic factors, and we have the red numbers, which are the environmental factors. The more we bet, the more chances we have to suffer from the disease. It is a multifactorial heredity. We need the effect of the genes plus the environment to develop the disease. Osteoporosis is characterized by low bone mass and microarchitectural deterioration of bone tissue, leading to increased bone fragility and consequently to increased fracture risk. It is estimated that 1 in 5 women over 50 have osteoporosis, and that about half of them will have a hip, wrist, or vertebrae fracture after the age of 50. Osteoporosis happens when the body is unable to form enough new bone, or when too much old bone is reabsorbed by the body, or both of them at the same time. The peak bone mass is reached at about 30 years old. Usually the bone loss occurs gradually over a period of several years, and often the person will suffer a fracture before becoming aware of the presence of osteoporosis. And when this happens, the disease is in its advanced stages and damage is severe. A significant proportion of the variation of bone mass density in people is due to genetic factors, as much as 80%. There are 3 genes associated with bone tissue, and we are going to see them one by one. Collagen type 1 gene is involved in the regulation of collagen synthesis and therefore considered as a marker of predisposition to osteoporosis and fracture risk. The allele being studied is associated with a high risk of suffering osteoporotic fracture, homozygotes having a higher risk than heterozygotes. Estrogen receptor 1 gene is the second gene we study. Estrogens protect bone mass during postmenopause and they have anti-refractory effect even several years after the period of administration of estrogens. The polymorphism in this gene must be taken into account when evaluating the risk versus benefits of hormone replacement therapy, being not recommended in women with the homozygous genotype. Vitamin D receptor is the third gene studied. Polymorphisms in this gene can alter the response to treatment with calcium. The analysis of these genes' polymorphisms have shown that they are associated with low bone density or fracture risk. Who is this test recommended for? Women at risk, those who have already turned 30, or those younger that have a family history of osteoporosis. And why undergoing the test? The objective is to treat the patient with a personalized therapy based on her genetic results. Also preventing bone fractures in the patient and family members that have a genetic risk even if they don't know it yet. Now we'll explain how to make this genetic test. We are going to take oral mucosa cells or saliva sample. We are going to receive a couple of swabs for each patient. We open the package, breaking the security seal, and remove the swab without touching the cotton swab. We insert the cotton swab inside the mouth of the patient, and we rub up and down on the interior of the cheek area for at least 1 minute, pressing firmly. We take 2 swabs per patient, one for each interior of each cheek. Once we take the sample, we place it back in the protected tube, and we identify the tube with the patient's full name and seal it with adhesive tape or similar. This is the summary of the general protocol. The specialist is going to receive the patient in a first consultation, and during this consultation they take the sample and they fill in the request form for a genetic test. Then the specialist will send by courier the samples together with the document to Genyca, and Genyca will send back by email with protected password the results to the doctor. The specialist will see the patient in a second consultation, will show the results, will explain, and will give the recommendations. Undergoing an osteoporosis genetic test is easy, it's a saliva sample, it's painless, it is convenient, it can be done at the consultation, it is unique, genetic results are valid for life, it is innovative, it is a new tool for the specialists at the forefront of technology. Familial, because results allow preventing bone fractures in relatives. Effective, allows applying a personalized treatment based on the patient's genetic results. Thank you very much for your attention today. Hope this was interesting for your clinical practice. And please remember that prevent today is important to avoid future fractures. My name is Clarissa Miel, and I am at your entire disposal for any complementary information. You can write to the email you can see on the slide, cmiel@genyca.s. Thank you, and hope to hear from you soon. Goodbye.